Miami Moms Vlog. My name is Jackie Aviles, and I'm here at South Miami Hospital, where we're talking all things about pregnancy, labor, and delivery during this season of COVID-19. It's an honor to meet you today. Can you tell us a little bit about yourself and maybe your expertise here at Baptist Hospital?
Sure, my pleasure. I'm an obstetrician gynecologist, which means I take care of women who are pregnant and having babies, and I also do gynecology, which is basically just women's care from their young years, teenage, all the way through menopause and the years later in life.
So many of my friends personally are expecting or just about to deliver their baby. And in this season, it can really bring up a lot of emotions. I mean, fear, anxiety. So I would have to ask you, what advice do you have for the pregnant moms out there who are just so nervous about delivering their baby during the season of COVID?
Right. So everybody's nervous right now, right? So you can expect that if you are pregnant, it's just heightened anxiety. So because you're not worried only about yourself, but you have your unborn baby that you're worried about. So COVID-19 is a new virus, so we're learning new information every day. But so far, I do have some reassuring information for pregnant women, which is good. In general, respiratory infections make pregnant women sicker. So we worry, like if a pregnant woman were to get the flu, they can actually get much sicker and have a higher risk of hospitalization. But so far, with the information we have for COVID-19, we haven't seen that for pregnant women. So compared to the general population, we are not seeing pregnant women get sicker with COVID-19. So it is a little bit of reassuring information, but everybody is nervous.
Now, every expectant mother is probably trying to prepare as much as they can for their delivery. They want to see that baby and they want to do as much as they can to get ready. So are there any additional precautions that you would suggest for a pregnant woman during this time?
A pregnant woman really doesn't want to get COVID-19 for sure, and especially not at that time that they're having the baby. We have to separate the baby, and they don't want to give COVID-19 to their baby after the birth process. So, all the precautions that everybody's hearing every day from the CDC, we want our pregnant patients to do and really take it to a whole nother level. So what you hear about social distancing, hand washing, really don't go out to places that you don't have to go out to. Really take all those extra precautions and try and protect yourself and don't get COVID-19 if you can really try and prevent that.
Now, one popular question has been circling the internet, and while there are a vast number of articles on this particular topic, could you share on the areas of greatest concern or even risk to the mother and baby if a pregnant woman were to be diagnosed with COVID-19?
For the mom, we haven't really seen the pregnant mom get sicker compared to a woman who is not pregnant. And then when it comes to the baby, we really haven't seen anything really significant that happens to the baby. Like compare this to the time of Zika, right? People remember Zika, it wasn't that long ago. Zika really had a negative impact on the baby. So we're not seeing that right now. Of course, I did mention it is a new virus and we learn new information every day, but we're not seeing really harmful effects of what COVID-19 can actually do to the baby. We have seen maybe some increased preterm labor, but that data is a little uncertain. So it's all a little bit of an unknown, but we haven't seen anything really horribly negative to either mom or baby so far.
Yes, and we understand that hospitals may even have different protocols regarding pre and post labor and delivery during this season. I guess I would ask you, what are the restrictions for Baptist Hospital specifically? Are there visitors allowed? Should mothers isolate themselves? Can you take us a little through that process and what it looks like?
All moms, when they come into the hospital, are being tested for COVID-19. So we really want to know when they're in the hospital if they have COVID-19. So if you come in active labor, you actually will get a rapid test. That swab that goes up all through your nose, and your partner cannot be with you until that test comes back negative, hopefully. So that is, something to expect when you're coming to one of our Baptist Health hospitals.
Absolutely.
The visitation policy is always changing. In the beginning, at the peak of the pandemic, there was no visitors allowed. Now you're allowed to have one adult visitor on the postpartum floor for just a very limited amount of time. But now everybody's heard about our spike in cases, so this might be changing at any time. So when you need to, I think, ask at the time that you're going into the hospital what that visitation policy is. And then you also just want to be really careful yourself. You want to make sure you know if somebody is coming to visit you in the hospital, where they have been and so forth.
Now, out of curiosity, what impact could COVID-19 have on a newborn? For example, does it affect breastfeeding? I know you talked a little bit about that earlier. Can pregnant women pass the coronavirus to their babies?
So we haven't really seen the COVID-19 pass from the mom to the baby in utero. There's maybe been some very limited reports of that, but it's more about after the baby is born, if you're not doing all your precautions with the hand washing and you're in very close contact to your baby, that you would transmit it just the way you can transmit it to any other person. So if you have COVID-19 and then you've had your baby, if that occurs in the hospital, you have COVID-19, you're being separated from your baby from the moment that baby is born. And everybody knows how important that time is, that you really want to have that bonding. So leading up to that time of birth, that's why you really want to make sure you are taking your precautions to not get COVID-19. When it comes to breastfeeding, we recommend breastfeeding for sure, and we have not found an issue with breastfeeding if you do have COVID-19.
So we know that prenatal care is super important. What precautions or maybe safety measures are being observed at our OBGYN offices for maybe routine appointments? Does technology play a part? Is it recommended to have prenatal appointments virtually now? I know everything's going online.
So telemedicine has become very popular for sure. Absolutely. And we are doing a lot more telemedicine even with our prenatal visits. So there's some of those visits you maybe have just gone for your big anatomy ultrasound and you've seen the baby, and normally your next visit may have been 2 weeks later in your doctor's office, and it's not so important necessarily to come into the office at that time. That's a great time for potentially a telemedicine visit where you can discuss what those ultrasound findings were over the phone. So we have adjusted prenatal care and prenatal visits during this time period for sure, and I'm sure each doctor's office is doing it a little bit differently, but it is a different time.
Dr. Schwartzbard, I've loved listening and really just learning so much from you today. And on behalf of Miami Moms Blog, I want to thank you for your time and for really just educating all of those watching as well. It's been an honor to be here today, and I know many will benefit from this information during the season. So I guess my last question is a bit more personal. For those watching and really needing a bit of inspiration, what would you say to them? Maybe a quote or a word of encouragement?
I want everybody to stay safe, but still reach out to your support system, because I feel like it might be a very difficult time. People are really staying home a lot more. And then, postpartum depression is something that can happen a lot more frequently. But if you're not reaching out to your support system, whether it's maybe through a Zoom call, FaceTime, whatever it is, just know that you have family, friends, support out there. So, don't lose touch, but still stay safe.
Love that. Absolutely. Thank you. Thank you so much for saying that. Thank you for joining us today.
Thank you for having me.
Thanks for joining us today, and make sure to visit MiamiMomsBlog.com. You can also follow us on all of our social media channels at Miami Moms Blog.